Good morning. It's February boy. I haven't been on here in a few weeks, so I thought I'd make a new video. Um, First of all, I'm going to tell you what's going on with my CHF. People don't know what CHF is. It's congestive heart failure. All my numbers were good the last time I went to the doctor. I still got October the 25th. I got an appointment to do another echo. Hopefully, my fraction rate goes up because of all the brand new medications that I'm taking, which have become a little bit more expensive. But anyways, besides that, I'm doing fine. I just want to show you things that I have that I got to go through every day. Blood pressure machine. I'm not one of these ones that like to take blood pressure all the time, because I think that'll drive you nuts if you did that. So I do take it now twice a day. I keep records of everything that I do, and so anyways, then I got my diabetes kit, which I have to take my blood sugar at least 3 to 4 times a day. Oxygen level and heart rate, which, you know, get my heart rate on my Apple Watch, so it's all keeping track of. A temperature thing, I use that maybe once in a while, not all the time. These are alcohol swabs. I've found these little nice looking little things to put them in. They're little pads, alcohol pads, for when I check my blood sugar. I've been drinking this core, one a day at least, and then I drink other water during the day. But I add one of these to my thing because I gotta keep my electrolytes levels at a good, you know, where they're supposed to be. Which so far, since I've been doing it, my everything, potassium, everything, sodium, everything's good. So I'm good. Glycerna. I drink one of these a day. I replace a meal with this. It's made for diabetics. It's made by Abbott, the same people that make my Freestyle Light glucose tester. So I drink one of these a day. Sometimes, most of the time, I like the chocolate better. I do drink the strawberry, and I have drink the vanilla. They're all good. I just prefer the chocolate. So, anyways, that's what I've been doing. And I keep records of everything. It's like a journal. And then when I go to the doctors, when they ask me how things are going, I just show them. I just hand it to them. And if I forget to take my journal with me, what I do is everything's on my iPhone. iPhone has everything that I do on my iPhone. So that's the way I keep track of it. So, and they really like that because it helps them. You know, I don't have to see them as often by doing this. So, you know, the only thing I really don't like doing, like I said, is this. To me, it's a habit you need not to get into. But I force myself to do it at least once a day, sometimes twice a day. My blood pressure stays the same. And I'll tell you what, this machine and my doctors, when they take it, it's like right on. It's almost the same, exact same. So this has been a great machine since I got it. Also that, you know, like I said, I go to get tested, another echo, check my fraction rate in October the 25th. Hopefully all the new medications that I started to take, I started a new one called Anestro and Jordian. And the Jordian has been a miracle, and the Anestro is working great too. At first I didn't think I was going to be able to take it because it was kind of making me feel bad, but then I found out because I started taking Jordian and Anestro at the same time, that was the reason for it. Maybe that's the way I feel. It made me feel bad. But then I decided, I told her, the RN, that I'd go on back on the Anestro since I'd already got used to to the Jordian. So once I started back on it, I have had no issues at all. It's more expensive. It's even with Medicare and stuff, I'm still paying out of pocket more than than I actually can afford. So I did away with my cable. I figured, okay, I'll do away with cable. Stuff like that, stuff that I don't really need. Because like I got Amazon Prime that I paid for annually. So I pretty much, just cut back on other things, so I take care of the medications that I get. That is part that I just wanted to let you know what's going on with all that stuff and what I do to help my problem. I've also as of the last Monday, I think, when I went to the doctor, last Tuesday, I don't remember what day, I go so often anymore. I had lost 14 pounds, but even since that day, I've lost another 3, so I'm down 17 pounds from when I started keeping track of this stuff. So once I started on all these new medications, I started keeping track of my weight, and I've lost 17 pounds. I eat, like I said, this here, I supplement one meal with that, and I try to eat healthy stuff, mostly vegetables. I do throw meat in there once in a while. I keep my sodium level down. If I don't eat much sodium in the morning, then I'll eat a little bit more sodium, because you can't completely do without the sodium, but you got to keep it down. So I keep it, as long as I keep it down below 2,000, I'm good. So sodium and so I watch what I'm doing there. So it's been a process, but it seems to be working. So I'm just going to keep on doing it. I know that this is probably. I know that this sounds funny, and I'm not, and it is. But I understand the disease more now. I've had it for 2 years now. Knock on wood. I mean, I not went into second stage yet, which is a good thing. And if I can keep my numbers down and keep exercising, which I do, I walk more than 45 minutes a day. I lift light weights, do resistant bands. So I am really trying very hard to do prolong as long as I can before I go into second stage. Once you get into second stage, third stage, things get a little bit rougher. So I already know it, so prepared. I'm not a bit afraid of it. There's no sense. But I think everything's going to be fine. I just want to be around longer for my kids mostly, and my grandkids, especially my kids and my grandkids. I just want to see my grandkids, get older and be as good as they are. I mean, these grandkids of mine are great. I mean, I have no issues with them. They have no issues. They don't cause problems. They're just good kids. I mean, I guess I can lay that up to their parents. Their parents have really done good with them, and I'm proud of my children for doing that. And so I'm happy for them. And of course, I got a younger son. Hopefully, one day that he'll make me a grandfather too. Him and his fiance. I'm still waiting. I know it's going to happen. I know it will, but I hope it don't take too much longer. I mean, I just hope things get better. They do what. I know they want to do it at their own time. I understand that, and I respect them. So, bottom line, this is just a story about what's going on and how I deal with it. By the way, this core, it is hard to come by. Most of the time you go to the grocery stores and and Walmart grocery stores, any of them, they're always out. I've been having to order off of Amazon, which for some reason lately, it's even been harder to get from there. And what's so weird about it, okay, you know, I live in Fort Worth area, and this stuff is actually made and bottled in Plano, Texas. So think about that. Why am I having so much trouble getting this stuff? Maybe Core, if they seen this, would, you know, let me know why. Abbott takes care of this. I mean, I have trouble. It's expensive, but it's worth it, you know. I mean, you think about it, you get 6 bottles for $9.99, and so I'm taking one meal out, so that's a $2 meal. I mean, it's cheaper than McDonald's, so, and it's better for me anyway. So I try not to eat junk, but, you know, it's hard. When you're a diabetic, you crave junk, you crave carbs. And so it's hard. But you know what? I've actually cut sugar completely out of my diet. No sugar. None. I haven't had sugar in 2 months. I mean, I completely decided one day, I woke up and I said, I don't want no sugar. So no pancakes, no nothing. No sugar at all. No cakes, cookies, nothing. I don't even want it around me. I mean they can be around me because I am very strong person when it comes to wanting to quit something. I quit. It's like when I used to smoke. No, it's been 15, 16 years now ago. I just threw the cigarettes away. I didn't go put a patch on. I didn't run to the doctor every 5 minutes because I, you know, couldn't quit smoking. I just give it up. I wish a lot of people that I know that's still doing it, I wish they would quit. But, you know, it's their thing. So if that's what they want to do, it's fine. But it's a nasty habit. This vaping stuff is nasty too. So people that are doing that, they need to stop doing that too. But anyway, this was just an informative type video that I did today. You know, I'm going to get back into other stuff. I want to watch what I'm saying because it seems like it irritates. Some people get irritated too easy, so I don't want to irritate nobody, especially when it comes to anything political, religion, or anything. You got to watch what you say, but which I'm not afraid to say because at my age, who cares? You know, I don't care what people think of me. But anyways, this is February Boy. Comment, like, share. Come on, get a YouTube video. Get a YouTube subscription. Go on there, subscribe to me. I mean, I don't do these elaborate videos, but I do informative videos anyways, and maybe I can help one person, you know, that'd be fine. Anyways, you have a good day, and I will be seeing you soon.